Hello, my name is Emma Lovelace, and I'm a student at the University of Missouri studying physical therapy, and today I'll be discussing kinesiotape as an alternative treatment to taking opioids to treat lower back pain in pregnant women. Kinesiotape has developed new advancements and techniques over the years to help relieve pain, especially lower back pain in pregnant women. While the cause of lower back pain during pregnancy is unknown, it is hypothesized to be due to ligament laxity and postural changes. Due to these changes, it can cause the center of gravity to shift and decrease stability, causing the lower back pain. Kinesiotape is effective in this case because it supports the lumbosacral structures, increasing stability, reducing paraspinal stress, and stimulating connective tissue, creating pain relief. One way to use kinesiotape to the lumbar spine is to apply 4 eye-shaped kinesio bands with a width of 5 centimeters and 0.5 millimeters in thickness. 2 pieces will be along the lumbar spine vertically from the lower posterior iliac crest to the upper 12th rib region using the inhibition technique. The other 2 pieces are placed horizontally using the space correction technique. This method allows relief of the lumbar and pelvic girdle pain because it allows muscle activation, joint repositioning, and reduces abnormal muscular tension. It is important to note that some patients may experience minor allergic reactions to kinesiotape. However, there are no studies on file currently that give evidence of serious adverse effects, making this one of the safest treatment options for pregnant women within physical therapy. One reason why kinesiotape is a popular choice among pregnant women is because of the limited options of pain-relieving medication allowed. One medication in particular that is detrimental to the development of the baby in utero are opioids. Taking opioids during pregnancy can cause birth defects such as congenital heart defects, neural tube defects, talipes, and orofacial clefts. Additionally, opioid use is addictive, which puts patients at risk for an overdose, leading to respiratory depression that would limit oxygen to the fetus and mother. Furthermore, it is discouraged to prescribe women opioids postpartum due to the addictive nature of the drug, causing concerns for parenting safety. This is why it is important for mothers to understand through patient education why taking opioids are such a risky decision. It is very important that physical therapists provide effective patient education to allow pregnant women to make the safest choices for themselves and their baby. Due to opioids causing harm to fetal development, it will be crucial that physical therapists have a rich understanding of how opioids operate, what risk factors are involved, relay information to the pregnant patient in layman terms, and provide alternative pain management opportunities within the scope of physical therapy. Considering where the patient was at prior to and during pregnancy will be important information to get during the initial evaluation so that a physical therapist can give them the appropriate resources. Some women may come into the clinic already suffering with an opioid addiction and seek an alternative approach to managing lower back pain. With someone in this situation, it would be important to provide resources to them on not only the benefits of kinesiotape, but also counseling to handle the stressors of addiction and withdrawal to promote a smoother pregnancy and healthier lifestyle. In today's world of technology, that can be used to help with patient education by allowing a patient to audio record the information you give them so that they have the instructions to recall back to and any other video demonstrations that could be useful in managing their lower back pain. Pregnancy is a time in many women's lives where there are plenty of bodily changes. Any other external factors making this transition more difficult is the last thing a mother could want. Evolving techniques with the kinesiotape will provide a low-maintenance, pain-relieving treatment to busy mothers with little to no side effects. There are no stressors related to taking an oral medication at a certain time, having the physiology of the body imbalanced, and no withdrawal or side effects that could come along with taking opioids. Additionally, it requires little effort on the mother's part as kinesiotape must be applied by a physical therapist. The intention of physical therapy is to improve a patient's quality of life, not inhibit it, despite the many challenges that they may face on a regular basis. This is why the many modalities offered in this profession can be great alternatives to or even be the best primary treatment for the most rigorous of conditions.